Good afternoon, and thank you for joining us this March the 7th for our media briefing. For today, I'd like to welcome Michelle Baird, our Public Health Services COVID-19 Operations Chief, and Jason Thorne, our Emergency Operations Center Director, to give us some information today. And as you know, we're starting to see some easing of public health measures across the province of Ontario, which is great news for our local businesses and for us as a municipality. In alignment with the province's announcements, we're also turning our attention towards the reopening of our city facilities and resuming more regular delivery of in-person city services and programs. So beginning this month, we're starting to return many of our staff who've been working from home during the pandemic back to the workplace. This is an excellent sign of recovery for us as an organization. We've been working hard to ensure our facilities and municipal spaces, are following all of the established health and safety measures, so we are able to protect those working in our workspaces or visiting to access city services in person. So as we begin to welcome more residents and staff back into our workplaces, we will continue to see familiar public health and safety measures in place, which include masking inside public spaces and enhanced sanitation and more. So staff working in municipal service spaces will continue to do their daily health screening, and at this time continue to be subject to the city's mandatory COVID-19 vaccination verification policy. I have full confidence and support this work as we prepare to welcome our employees back to the workplace and offer more in-person services for our residents. With all of that, I will turn now to Jason Thorne, our Emergency Operations Center Director, for some updates as well. Jason?
Thank you very much, Mr. Mayor. And I don't have any new changes to report this afternoon, but I would like to provide just a couple of reminders to the public regarding the easing of those provincial public health measures, as well as the Mayor mentioned regarding the city's plan for returning staff to the workplace. As the public will know, on March 1st, the province announced the lifting of capacity limits in all remaining indoor public settings and the lifting of the proof of vaccination requirements for those settings. So that is now in place. Businesses and other settings may still choose to continue to require proof of vaccination, and they are still required to have masking requirements in place. In alignment with the province, the city has also lifted all remaining proof of vaccine requirements for members of the public who are attending our rec centers, our museums, the greenhouse, and other public facilities. This change does not impact the city's vaccine verification policy for city staff, which does still require all city employees to be fully vaccinated. As I mentioned at our last briefing, city staff will soon be transitioning back to the workplace in a phased and gradual way. Beginning the week of March the 21st, directors and general managers will be returning to the workplace, and then all those remaining staff who are currently working from home will commence a phased and gradual return starting on April the 4th. And we expect that transition to take place over approximately a 4 to 6 week period. This only relates to returning of staff to the workplace. At this time, for the public, only the first floor of City Hall, as well as our municipal service centers, are open to the public to access municipal service counters. We've not yet set a date for the reopening of the other City Hall counters to the public or for when council meetings will be returning to in person, but we do hope to be in a position to share more information about that in the very near future. So with that, I will turn things over to Michelle Baird.
Thanks, Jason. So good afternoon. Our COVID-19 health indicators continue to be low in Hamilton, with some surveillance indicators now leveling off. Locally, percent positivity of those being tested by PCR, new hospitalizations, and ICU admissions for COVID-19 reported each day have recently plateaued, while provincially they've seen a little bit of an increase in this indicator. Locally, we have 1 new hospital admission each day on average and less than 1 new ICU admission each day. Despite these decreases, our hospital partners do continue to report strain due to ongoing occupancy pressures. Hamilton Public Health Services does continue to report deaths associated with COVID-19, but this trend is decreasing overall. Today, Hamilton reported 1 additional COVID-19 death since Friday, March 4th. Hamilton's rate of percent positivity is sitting at 11.2%, which is similar to the provincial rate. Previously, we reported it as 12.1% for tests that had been completed. In addition, the number of active COVID-19 outbreaks has been consistently low in recent weeks. Currently, we have 5 active outbreaks, with 1 new being reported today and 1 outbreak being declared over since Friday. Details about these outbreaks are posted on our COVID-19 dashboard. We are cautiously optimistic about the province's planned easing of public health measures across Ontario in the weeks ahead. While Hamilton is past the peak and witnessing the decline of the Omicron-driven wave, we anticipate the risk of transmission will remain high through April as public health measures are lifted. The Omicron surge and the significant number of associated infections this winter, along with our high vaccination rates across our community, also means we have a strong line of defense. Collectively, we have learned a lot and have a number of tools to protect ourselves and one another as we transition to a more normal state and continue to learn to live safely with COVID-19. We have safe and effective COVID-19 vaccines, as well as safe and effective treatments in and outside of our local hospitals, along with well-established public health measures that will be needed in the coming weeks ahead and may be called on again locally down the road if conditions require it. With our community and the rest of Ontario gradually reopening and the planned easing of public health measures over the coming weeks, I encourage residents to take the necessary steps to live safely with COVID, prevent the spread of the Omicron variant, and reduce pressure on our healthcare system by getting fully vaccinated when eligible. Get a 3rd dose of COVID vaccine when you're eligible. Data from the province continues to show that vaccination, including that 3rd dose, provides strong protection against serious illness and hospitalization. In addition, residents should continue following current public health measures as directed by the province, being mindful of your contacts and staying home when you're unwell. With this in mind, individuals can complete their assessment of their personal risk as it relates to their comfort and safety in community settings. When it comes to Hamilton's COVID-19 vaccine program, our top priority continues to be opportunistic and hyper-localized strategies to increase the administration of 1st, 2nd, and 3rd doses of COVID-19 vaccines. This strategy will ensure protection against COVID-19 is equally distributed across local populations, the community, neighborhoods, and school communities with lower vaccine coverage rates. Overall, as a city, 87.3% of Hamiltonians 5 years of age and older have received a vaccine to date, and 83.6% are fully vaccinated. 50 children 5 to 11 years of age have received a 1st dose of vaccine, and 32% are fully vaccinated. For 3rd doses, over 287,000 people have gotten their booster to date, meaning that 52.9% of Hamilton's population, 12 plus, has a 3rd dose of vaccine. Through the last mile strategy, there continues to be a wide variety of clinic options for Hamiltonians to get vaccinated, such as large fixed site primary care-led clinics, school-based clinics, neighborhood pharmacies, community partner-led clinics, the Ministry of Health GoVax bus, as well as some mobile pop-up clinics. Community members wishing to receive a vaccine can get information about locations and eligibility on our website at www.hamilton.ca/getyourvaccine. There has been some public discussion recently regarding the use of wastewater data to determine the trends as it relates to COVID-19 in our community. Hamilton Public Health Services appreciates the use of wastewater data to determine the trends as it relates to COVID-19. However, it's not something that has worked as a predictive measure in Hamilton to date. We are continuing to work with the researcher to understand the data and its utility locally. Staff are working to obtain further data beyond what we already have. We have found the data to be variable as far as using it to determine trends, as well as it does in other jurisdictions. To date, Hamilton Public Health Services has found that percent positivity and our COVID-19 hospitalization data is more representative of COVID-19's current prevalence in Hamilton, while other traditional forms of surveillance are less accurate due to testing eligibility changes and the resulting underestimation of cases. Hamilton Public Health Services, however, is continuing to work with the province and the researchers to understand how this study is being incorporated into monitoring metrics going forward and to understand the relationship between wastewater trends and other metrics such as hospitalization. Hamilton Public Health Services will continue building on the COVID-19 progress to date in the weeks ahead. We have brought forward a whole of community response from the start of the COVID-19 pandemic, and each of us in Hamilton should be very proud of how we continue to come together to protect one another, including those most vulnerable and our healthcare system. Hamilton Public Health Services is grateful for the community's commitment to each other, and together with the many tools in our COVID-19 toolbox, we have and continue to learn how to live as safely as possible with the virus in order to get back to a normal life, safely doing all the activities we enjoy at home, at work, and in the community. And on that, I think I'm turning it back over to you, Mr. Mayor.
Thank you, Michelle, and thank you, Jason, for all that information. And as we can see, more business and facilities and programs are opening up, and we must continue to follow the public health guidelines. Remember that getting the vaccine and that booster dose is the best way to protect yourself and your loved ones from serious health or hospitalization. So do take the time to get that booster dose when you're eligible. And in light of the unpredictable elements that have come into the pandemic, staff have done their best to ensure safe access to activities are made available wherever possible. We know the pandemic has been difficult for many families in our community. And I'd like to take a moment to highlight that as we emerge from this pandemic, we have a few post-pandemic great events happening in our city. So maybe we're not quite post-pandemic, but certainly we're starting to feel that way. So the NHL Heritage Classic at the Donut Box at Tim Hortons Field, Toronto against the Maple Leafs is happening on Sunday evening, and I'm sure it's going to be a full house. About 30,000 folks are going to be enjoying that event. And then the day after, the Bulldogs play the Oshawa Generals on the same surface that Monday night as well, and they're using that as a good opportunity to raise funds as well for various causes. So if you can make it out to the Bulldogs game as well, that'd be fantastic. And also starting this Friday, the Springtide Bulb Shows returns to the Gage Park Greenhouse. If you have not been to the Gage Park Greenhouse, you'll quite enjoy it. It's quite a warm and welcoming space, and certainly the Tide Bulb event is something that hasn't been happening over the past few years. It's going to be on this year, so do look for that from the dates I don't have in front of me here, but I believe it's the 11th to the 17th, I believe. So do check that out, and if you can come, then do bring either a donation or a non-perishable food item for food share. Would be very much appreciated as well. On that note, Jasmine Graham is here, and she will guide us through any media questions. Jasmine.
Great. Thank you so much, Mr. Mayor. We have just two media joining us today, and as usual, we will start with one question and one follow-up for each of you. First to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for the questions. My first question is to Michelle. Michelle, public health has long said, including at this briefing today, that wastewater data, surveillance data, has not worked here. But the researchers who analyzed that data strenuously refute that, saying the data is remarkable and that it has shown clear trends here. And this has been backed up by other experts in wastewater surveillance, as well as the scientific director of the science table. So, I mean, how is it that we have this divide that public health seems to say this isn't working, but the researchers who specialize in this data say it is working? They say that public health has not used the resources available to them to understand the data.
Thanks for that question, Joanna. And as I mentioned, we certainly have been looking at this data and trying to understand its local application. We do know in the data that we've looked at, as I mentioned, we have some other indicators that have been more predictive for us in Hamilton. However, that being said, we are working with the researchers, and we have some planned meetings coming up in the very near future to better understand where that divide is and understand how we could perhaps use this data going forward.
On that same note, Michelle, the measures that you're talking about, the indicators like hospitalizations and ICU, those are lagging measures, while wastewater is increasingly being used to sort of predict COVID trends. Just today, Minister Elliott called it the canary in the coal mine and talked about how the province, is absolutely relying on data now. So where does this leave Hamilton if we've I know you're working on it, but at the moment it's pretty much been rejected in Hamilton. So where does that leave us when the rest of the province is relying on this data and we are not?
Thanks, Joanna. At this point, yes, hospitalizations, ICU data, and of course deaths are all lagging indicators. For us, percent positivity continues to be an indicator, sort of predicting where we are with COVID-19 activity in our community. As you said, other communities are using this data and finding it helpful, and we're certainly going to continue having those dialogues and investigate further. But at this time for us, it appeared to be a lagging indicator as well.
Thanks, Michelle. We'll go next to Aura from Hamilton Spectator. Aura, you can go ahead.
Thank you. Sorry, this question is for Michelle. I just wanted to know if you have any idea of how long these bi-weekly COVID updates will be going for.
Hi, Aura. I'm not sure that I'm the best one to answer this question. I would say certainly we need to continue to share information. And at this point, this is our means of doing so. I don't know if perhaps others have additional pieces they might want to add.
It's a conversation we're going to have over the next coming days in terms of the need to share information. And, it seems that there's less of a need today than there has been in the past. And so we're going to consider that and determine whether or not we continue or maybe we change the frequency of these media advisories going forward based on the circumstances we see out in our community.
Thank you both for your answer. I think this one is for Michelle now. So I just wanted to ask, which settings would you, with our restrictions lifting, which settings would you like to see mask requirements stay the longest in?
Thanks, Dora. So at this point in time, of course, masks continue to be required, and there has been no lifting of masking mandates to date. We know the province is continuing to look at that. And as they look at lifting of restrictions in Hamilton here, we'll look at our local guidance as well and look at the measures that are in place and bring recommendations forward as we go. At this point, because the masking mandate hasn't been changed provincially, we're of course satisfied with where masks are currently being used and would encourage people to continue to wear their mask, of course. As we go forward, I don't have any particular settings right now that I would recommend that we're going to change or not change. Certainly, we need to see where the province goes with their recommendations.
Thanks, Michelle, and I apologize, Aura. I said your media outlet was the Hamilton Spectator. It's in fact CBC Hamilton. We will go through for one more question for each of you. So back to Joanna, you can go ahead.
Thanks so much for the extra question. Vaccination per day has really been starting to drop in Hamilton. Is there something new that you're looking to do or some way that you can start to, maybe kickstart this again as certain groups, really have a little ways to go here still? So, what can you do to try and get that back up again?
Thanks, Joanna. So with respect to vaccination, you're right, and we certainly saw this after first doses and we saw it after second doses as well. That vaccine continues to be a personal choice, and upfront we have quite a demand for vaccine, and now that third dose eligibility has been open for some time, the demand of course drops off. We're continuing on that point then with our last mile strategy and continuing to offer quite hyper local. So you'll see that rather than running vaccine through mass vaccination clinics, that there's lots of other mobile opportunities happening. Vaccine very much in the community through community partners partners as well as community pharmacy, and that opportunistic vaccine we talked about where people are in a moment and offer the vaccine when they're having a conversation with a trusted healthcare provider. So much more of a hyper-targeted approach at this point in time. You know that vaccine continues to be offered in schools as well. So really trying to get the vaccine to the community members where they are, as opposed to bringing people into large-scale clinics. And we'll continue with that for the foreseeable future. At this point in time, we still are seeing uptake, but you're right that it's certainly been slowing.
Great, thank you, Michelle. We'll go back to Aura from CBC Hamilton. If you'd like another question, you can go ahead.
Thank you, and no worries, Jasmine. Yes, I wanted to ask Michelle, what message with the vaccination passports being no longer required in most places, what message would you like to send to those people who did get vaccinated?
Yeah, so vaccine passports, of course, one of those public health measures that has been lifted recently, and we would say that vaccine has been and continues to be an excellent way to protect yourself and your family against COVID-19. As we move forward with vaccine passports being removed, we're at a place, as noted, that we have great vaccine uptake in the city, and that individuals, regardless of the measures that are in place, mandated centrally, provincially, what have you, that you need to make personal choices for yourself and your family, whether that's about receiving vaccine, wearing a mask, being very cognizant and maintaining personal distance, those kinds of things. People still need to do what they need to do to protect themselves and their family and their communities. So for those that went ahead and got a vaccine, there's lots of reasons to do that outside of going to establishments where the passport was required. Getting your vaccine, of course, provides protection against COVID for you individually.
Great, thank you, Michelle. Mr. Mayor, that can be the end of our media questions for today, so I'll pass things back to you.
Okay, thank you, Jasmine, and thanks to Bill Custers and the entire team at Cable 14 and Clear Cable, and of course to our media questions, and thank you for sharing that with our broader community. For more information on COVID-19 financial supports and any updates, visit our website at hamilton.ca/coronavirus. And please continue to follow all public health measures and get your vaccine, get that booster. We need more people getting their booster shot. It's still the best way to protect yourself, your family, and community, and all of the businesses out there, as well as our healthcare system. So please do your best to get your booster as soon as you can. Residents can find the latest information on the city's website at www.hamilton.ca/coronavirus or by following us on social media. Our next proposed media briefing will be on March the 21st at 3 p.m. We will see you then.